Hey everyone, Dr. Charlie Johnson, physical therapist here, and I want to spend a couple minutes here talking to you about how people with back pain move, okay? Specifically, I want to talk about how people who have pain with sitting, driving, bending over, lifting, twisting, things like that tend to move, okay? What we see in the medical community and even a lot of physical therapists and just in general, a lot of people treat based off of a diagnosis, right? So if you're watching this video, the common diagnoses that we see in people who have pain when they sit, drive, bend, lift, or twist are what? Herniated discs and or sciatica, okay? So if you've been diagnosed with a herniated disc or sciatica, this video might just help you better understand how you move and how you could change how you move, all right? So I'm going to walk you through here in a moment, just 3 simple tests to help you kind of better understand what's going on, okay? Okay, and the big thing is that we want to, and I have it on the board here, maybe you can or cannot read it, we want to talk a little bit about treating the cause versus the source, okay? So again, the source of the pain in your back and or your leg, or maybe your leg numbness or tingling when you're bending, sitting, driving, lifting, or twisting is, again, most commonly found on an MRI to be, say, a herniated disc, okay? And the pain, numbness, tingling down the leg is called sciatica, okay? That would be the source of the problem. But there's a difference, right? We want to find out how you actually got there. So I want to know the cause of your problem. The cause is not the herniated disc. Somehow you moved in a specific way or you've been doing things a specific way to get you into that problem where you now have a herniated disc or whatever they may be saying is bothering your back, okay? So with that being said, here are the 3 tests, okay? And then we'll talk about kind of the commonality between all of them. Ready? So the first one is you're going to sit on the edge of a table or the edge of a chair or the edge of your bed, and you're just going to straighten your knee, okay? So you're just going to kick your knee out. Toes can be just, just relaxed. That's fine. Maybe do a few on one leg, a few on the other, and just see what happens, okay? Okay, so it's just seated, straightening your knee. That's the first test, okay? The second test, maybe you'll have to have somebody watch you do this, is you're going to stand and you're going to touch your toes, okay? So you're just going to bend forward. Touch your toes. That, in and of itself, might bother you. And if it does, you don't have to do many times. I just want you to, kind of test it out. Okay, that's the second test. And the third test is going to be this one. So you're going to get on your hands and knees. Again, feet can be hanging off the edge of a bed. And you're just going to rock backwards. So you're going to do this a few times. You're going to see if this bothers your back. Maybe it does, maybe it doesn't. It doesn't matter. I'll talk to you about what it means in a minute. Okay, so those are the 3 tests. And those are self-tests, again, to determine if you have pain with sitting, bending, lifting, or twisting, or driving, what movement problem could be causing your symptom. Okay, so let's talk about the first one. So the first one was just you straightening the knee. The common theme between all of these, okay, if you've had somebody watch you, okay, and if not, maybe do it again, is that the first thing to go is the back, meaning the back rounds excessively on all of these, okay? So picture this. So you're seated, you straighten your knee. You might notice that it's pretty darn hard to keep your back up tall. Now, if you force your back up tall and sit up really straight, maybe your back pain feels better right there, all right? But now try to straighten your knee and don't let yourself rock backwards, right? So it's a lot different than if I let myself fall, I can get my knee all the way straight, right? So just straighten and try to hold yourself there, okay? Notice how difficult that is, okay? So the big thing is that you already love to just kind of slouch, and maybe you know that about yourself. But now you can imagine as my legs straight and I'm trying to drive, if during this test you rock backwards, imagine what happens when you drive. You're just slouched the whole time, okay? That was the first test. The second test is that when you went to touch your toes, maybe you did something like this. See how rounded my back is there, right? Versus somebody else, like myself naturally, I would bend forward something like this. So I get a little bit more bend from the hips than from the back. 2 completely different ways to bend your back and 2 completely different feels that you'll get from that, okay? If you have, again, pain with sitting, bending, lifting, or twisting, you likely default to doing more of a back round, okay? Back round. The third test is when you're on your hands and knees and you rock backwards, you might notice that you're already a little bit kind of rounded to begin with, and then as you rock backwards, you really kind of round your back, all right? Try to hold the back up tall and then rock back and prevent your back from rounding. Okay? It's going to be pretty darn difficult. If you have pain with sitting, bending, lifting, twisting, or driving, likely as you rock backwards, you're going to be bending your spine excessively. Okay? This is the same thing as me sitting, right? So my hips are at this angle if I'm sitting or if I'm in that same test. Now imagine if during that test I get back here where my knees are kind of in front of my hips, if you draw a line, right? And my back is really rounded. Think about now if you sit in a low car or if you're sitting at a chair at work, and whenever your hip gets to this degree, you rock backwards, right? Not so good for the lower back. So with that being said, the common theme in people who have pain with bending, lifting, sitting, or twisting is that they round the back. And the back is always the first thing to go or to round. So it's very difficult for them to control the way that their back moves and keep it upright, okay? So with that being said, if this kind of describes you or it sounds like something you might have a problem with, remember, we want to get to the cause. As a physical therapist, we want to find the cause as to why you came in with, yes, you may have a herniated disc, but we want to understand how you got there. So a big part of it is about education, all right? So again, if this is you, sounds like some things that you're having trouble with, email me directly at charliejohnsondpt@gmail.com. Thanks so much.